So in this presentation, I'll be speaking about different types of equivalences. The first type of equivalence is called as the chemical equivalence. The second is called as the pharmaceutical equivalence. The third equivalence is bioequivalence. And the fourth is called as the therapeutic equivalence. So these are the four types of equivalences of a medication. So let us first talk about chemical equivalence. If you have drug A and a drug B, if the active pharmaceutical ingredient in drug A and drug B is similar and their strength is also similar, then it's called as the chemically equivalent medication. So A and B are chemically equivalent. The pharmaceutical equivalence, when drug A and drug B, they are same kinds of formulation like tablets or capsules. They have same amount of active ingredient. The purity is same, the quality is same, then it would be called as the pharmaceutical equivalence. The third type of equivalence is called as the bioequivalence. Now in bioequivalence, in the previous video we have spoken about bioavailability. Now drug A and drug B, if their bioavailability is same, then drug A and drug B are called as bioequivalent. Just to revise the definition of bioavailability. Bioavailability was rate and extent of absorption of the drug is called as bioavailability. If rate and extent of absorption of drug A is equal to rate and extent of absorption of drug B, then it is called as bioequivalent. That means drug A has similar bioavailability as that of drug B. Therapeutic equivalence. When drug A is administered, it produces X amount of response. When the other drug, that is drug B, is given, does it produce similar kind of therapeutic response? If yes, then drug A and drug B, they are therapeutically equivalent. Just to take an example, suppose there is a drug A which is used for the treatment of hypertension, and after giving X amount of drug, it produces 10 mm drop in the systolic blood pressure. Drug B also is available in the similar concentration, that also is being given to the patient of hypertension, and that also produces similar fall in the blood pressure. Then drug A and drug B would be called as having a therapeutic equivalence. So we need to understand whether the drug is chemically equivalent, pharmaceutically equivalent, bioequivalent, and therapeutically equivalent. Just to show the graph of bioequivalence, the graph of bioequivalence can be plotted. On the x-axis we have the time, and on the y-axis we have the concentration. And as in the previous video, we have already seen that bioavailability is nothing but the rate and extent. So suppose this is my therapeutic concentration. Therapeutic concentration. Now what is meaning of therapeutic concentration is this much minimum concentration is needed for the drug to produce action. Now if this is the drug A has crossed the concentration which is required for producing therapeutic effect. That means this drug is having X amount of bioavailability, and it is more, the concentration is more than the required therapeutic concentration. If I have another drug B, this is drug B. Now the drug B has certain amount of bioavailability, but it has not reached the therapeutic concentration. So I can say that drug B has lesser bioavailability compared to drug A, and drug B will not be effective because it has not reached the therapeutic concentration. There could be drug C which behaves like this. So drug C also is not bioequivalent to drug A or drug B, although the drug C has reached the therapeutic concentration here, but the bioavailability of C may not be equivalent to that of A and that of B. So this is the concept of bioequivalence. To say two drugs are bioequivalent, the bioavailability of the both medication, that is rate and extent of two medication, should be similar to each other. Now it may happen that the drug has certain concentration here, which is called as the toxic concentration, which means if the concentration goes beyond this dotted line, which is red, the drug would be called as toxic and it will cause toxic adverse events. Now the drug A has produced therapeutic concentration, however it has not reached the level of toxic concentration. So this range is called as the therapeutic index. So the drug A would be effective also, and the drug A would be well tolerated also, because it has not crossed the limit of toxic concentration. So wider is this gap between the therapeutic concentration and the toxic concentration, safer would be the medication. Shorter is the gap between the therapeutic concentration and the toxic concentration, the drug would be more toxic. So the drugs which has very narrow window between therapeutic concentration and the toxic concentration, that drug would be called as the drug with a low therapeutic index. So this is about 4 types of equivalences: chemical, pharmaceutical, bioequivalent and therapeutic equivalence. Thank you.